Video is going to be about HPV vaccination. This is going to be a very short video, and this is important from clinical practice point of view, as well as it is important for postgraduates. It can be asked as a short note, especially in paper 4, that is recent advances, or it can be asked on table viva, or as a part of long case discussion. Some details about the HPV vaccination will be asked. It from MRCOG point of view, it can be a SBA about HPV vaccine, especially the types which are covered. And for MRCOG part 3 point of view, it can be a part of role player station, especially in preventive oncology, where the role player is asking some details about the HPV vaccination, and we need to provide information regarding the dosing schedules, as well as adverse reactions, and pregnancy and vaccination schedule. So today we will be covering about introduction, types of HPV vaccines, dosing schedule, contraindications and precautions, and adverse reactions. HPV vaccine is the most recent vaccine that protects against 90% of the HPV strains which cause cervical cancer, 90% of HPV strains that cause anal cancer, 90% of HPV strains that cause genital warts, and most strains that cause mouth and throat cancer. So almost 90% of the cervical cancer, anal cancer, and genital warts HPV strains, there is a protection, and against most strains which cause mouth and throat cancers, this vaccine is effective. So HPV vaccination prevents new HPV infections but does not treat existing HPV infections or diseases. HPV vaccine works best when given before any exposure to the HPV. Most sexually active adults have already been exposed to the HPV. However, they may not have the infection with the same type or with all types which are covered by the vaccination. At any age, having new sex partner is a risk factor for getting a new HPV infection. People who are in long-term mutually monogamous relationship are not likely to get a new HPV infection. So HPV vaccine is a series of shots that protects you from the human papillomavirus, which often spreads through the sexual contact. There are almost 40 types of HPV strains. 80% of the sexually active people will have an exposure to the HPV infection. And who should get the HPV vaccine? The target age group is 11 to 12. We will see in the next slide the dosing schedule. However, adults up to and including age 26, the vaccination can be given. In some cases, adults up to and including age 45. We will see the details about this particular age group. So what is the dosing schedule? There are two dosing schedules. One is a 2-dose schedule, another is a 3-dose schedule. So what is 2-dose schedule? 2 doses for adolescents starting the series before their 15th birthday. So adolescents 11 to 12 years are the targets. However, it can be given between 9 to 15 years of age. So when it is started before 15 years of age, only 2 doses are required. The second dose should be given 6 to 12 months after the first dose. Adolescents who receives 2 doses in less than 5 months apart will require a third dose of HPV vaccine. So this is going to be very, very important. 2 doses will be required when it is started before 15 years of age, and the interval between the 2 doses is 6 months. If it is less than 5 months, in that particular case, third dose will be required. The target age group is 11 to 12 years. However, vaccination can be started after 9 years, and the first dose, if given before 15 years, then only 2 doses are required. Okay. And second schedule is a 3-dose schedule. For 3 doses, it is recommended for teens and young adults who start their series after the age of 15 up to the age of 26 years, and for immunocompromised person. So those who are starting the vaccination after 15 years of age up to 26 years, 3 doses will be required. And for all immunocompromised persons, even if they start their vaccination prior to 15 years, then also 3 doses will be required. So the recommended 3-dose schedule is 0, second dose after 1 to 2 months, and third dose at 6 months. So 3 doses are recommended for immunocompromised person, including those with HIV infection, and even if their age is between 9 to 26 years. What about 26 years, that is 27 to 45 years? There is a shared decision making. Vaccine is not recommended for everyone older than 26 years. Some adults ages between 27 to 45 years might decide to get HPV vaccine based on discussion with their clinician if they did not get adequately vaccinated when they were younger. So in that particular case, it can be considered. HPV vaccination of people in this range provides less benefit for several reasons, because most of the people in this particular age group will already have been exposed to the HPV. For adults between the 27 to 45 years, clinician can consider discussing HPV vaccination with people who are most likely to benefit. HPV vaccination does not need to be discussed with most adults who are more than 26 years. So there are three types of vaccines which are available, that is Cervarix, Gardasil and Gardasil 9. So let us see about the comparison between the three vaccines. The Cervarix, the manufacturer is a GlaxoSmithKline, while Gardasil and Gardasil 9, they are manufacturer is Merck, and Cervarix is a bivalent, while Gardasil is a quadrivalent, and Gardasil 9 is a nonavalent. Cervarix covers only two types of HPV strains, that is 16 and 18, while Gardasil will cover four strains, that is 6, 11, 16, 18. Gardasil 9 will cover the same four plus additional 5. So four which are covered by the Gardasil, that is 6, 11, 16, 18. Apart from that, it will cover 31, 33, 45, 52 and 58. Now what is the protection rate against cervical cancer? Cervarix has got a 70% protection, while Gardasil 70 to 75% and Gardasil 9 90%. There is a difference in the adjuvant which is present in Cervarix and Gardasil. It is MPL absorbed on aluminum hydroxide in Cervarix, while Gardasil and Gardasil 9 will have aluminum hydroxyphosphate sulfate. About the expression system, for Cervarix, it is a baculovirus insect cell, while Gardasil and Gardasil 9 are derived from yeast, that is Baker's yeast, also known as Saccharomyces cerevisiae. There is a cross protection by Cervarix against HPV 13 and 35. For Gardasil, it is cross protection against HPV 31. However, cross protection against other strains is not known for Gardasil 9. Coming to the vaccine efficacy, it is 11 years for Cervarix, it is 10 years for Gardasil and 6 years for Gardasil 9. And adverse effects for Cervarix mainly localized pain at injection site and inflammation, while Gardasil 9 local pain, edema, muscular pain, dysentery, fever, vomiting. These are the side effects with the Gardasil. And for Gardasil 9, pain at injection site and swelling. These are the side effects. Coming to the contraindications and precautions, severe allergic reactions, especially the anaphylaxis to a vaccine component following a previous HPV vaccine is a contraindication for giving HPV vaccine. For nonavalent HPV vaccine, which is produced by the Baker's from the Baker's yeast, that is Saccharomyces cerevisiae. So any hypersensitivity to the yeast is a contraindication for nonavalent HPV vaccine. Moderate or severe acute illness is a precaution to vaccination, and vaccination should be deferred until the symptoms of acute illness improve. Minor acute illness such as diarrhea, mild urticaria with or without fever is not a reason to defer the vaccination. Coming to the pregnancy and HPV vaccine. HPV vaccine is not recommended during pregnancy. Pregnant women should delay initiation of vaccination until the pregnancy is over. However, pregnancy testing before vaccination is not needed. Although HPV vaccines have not been linked to causing adverse outcomes or side effects to developing fetus among pregnant vaccinated inadvertently. However, there are no clinical trials of HPV vaccine in pregnant females. If person is found to be pregnant after starting the HPV vaccine series, that is second and third dose needs to be delayed until they are no longer pregnant. If a person receives HPV vaccine and later learns that they are pregnant, there is no reason to be alarmed. Coming to the vaccine safety, HPV vaccine is very safe. Scientific research shows the benefits of HPV vaccination far outweigh the potential risk. Like all medical interventions, vaccine can have some side effects. Nonavalent HPV vaccine, that is Gardasil 9, was studied in more than 15,000 males and females and was found to be safe and effective. Coming to the adverse reaction, the most common adverse reaction during the clinical trials were local reactions at the site of injection, that is pain, redness, swelling, that has been reported in 20 to 90% of recipients. Temperature of 100 degree Fahrenheit during first 15 days after the vaccination was reported in 10 to 13% of the HPV vaccine recipients. However, same has also been reported in the placebo group. A variety of systemic adverse reactions, that is nausea, dizziness, myalgia, and malaise, with equal frequency has been reported in the vaccinated group as well as placebo recipients. There were no serious adverse events following HPV vaccine. Ongoing monitoring is conducted by the CDC and FDA. Syncope, that is fainting, can occur after any medical procedure, including vaccination. Adolescents should be seated or lying down during vaccination and remain in that position for 15 minutes after the vaccination. This is to prevent any injury which can occur from a fall during a syncopal event. So these are the references from CDC guidelines and ACOG committee opinion about human papilloma virus vaccination. Thank you.